Peace be upon you and God's mercy and blessings. In this video, we will learn about case control studies, also known as case control study. When we look at evidence-based medicine or the evidence-based medicine pyramid, we find that case control studies are at the top of this pyramid, specifically in the yellow section. When looking at this pyramid at the bottom, you find descriptive studies such as case reports or cross-sectional studies. These are followed by analytical studies like cohort studies or case control studies, which is the topic of this video. Then in terms of strength come randomized controlled studies such as clinical trial studies or randomized clinical trial studies. And above those in strength, representing the highest level of evidence, are systematic reviews and meta-analyses. And as I mentioned earlier, this particular type of study meticulously synthesizes all available research, providing a comprehensive and unbiased summary of findings. Is shown here in yellow, as we can see. And when conducting this type of study, it is possible to test the hypothesis. This is the exact opposite of a cohort study. In a cohort study, you start with the cause and wait for the outcome. But in a specific type of case control study, you typically start with the observed outcome and then carefully look for the underlying cause. So in a cohort study, you start with the cause, while in a case control study, you start with the disease or the outcome. This type of study is considered effective for certain diseases. For example, if we want to study for children with cleft lip or cleft lip and cleft palate, it's easier to gather a group of children who were born with a cleft lip and compare them to another group of children who do not have a cleft lip and look for the cause of that cleft. For example, did the mothers smoke during pregnancy? You start from the disease and then go back to the cause of this disease. If we wanted to conduct a cohort study, we would bring in mothers who smoke and compare them to other mothers who do not smoke, and then wait or find out how many children are born with a cleft lip in both groups, which is an inefficient method. Therefore, in some topics, this type of study is considered more effective compared to the cohort study. Thus, this type of study is usually conducted in the past, where we start from the disease or outcome and go back to the cause in the past, so it is a retrospective study. Therefore, this type of study differs from cohort studies in that it is only conducted in the past. Also, in this type of study, it is not possible to calculate the incidence rate of new cases. It is possible to calculate the prevalence of the disease, but it is not possible to calculate the incidence. Therefore, it is possible to calculate the odds ratio in this type of study, but it is not possible to calculate the relative risk. So if we take this example, if we wanted to conduct a study on hepatitis A and we wanted to find out the cause of this hepatitis, a group of people with hepatitis A is brought in and compared to another group that is not infected with hepatitis to find out the cause of that disease in the patients. Therefore, this type of study is excellent for rare diseases. It is also considered an excellent study designed for diseases that take a long time to develop. Additionally, it is more efficient in terms of time and cost. However, it has the following drawbacks. First, there is the possibility of bias when selecting the groups, especially when dividing the disease group and the comparison group. And sometimes there is bias in the way cases are assessed. And among the most common problems faced by this type of study is what is known as recall bias, which occurs when asking the participant about things in the past. They may not be able to remember those things, which leads to what we know as recall bias. And finally, when conducting interviews with people, this may lead to what is known as interview bias, where the way questions are asked causes a type of bias. Also, it is not possible to calculate the incidence rate of new cases. Instead, we can use the prevalence rate of the disease. And we also cannot talk about a clear and direct cause for the disease compared to cohort studies and RCT studies. In this diagram, We illustrate how these studies are conducted, where a group of people with the disease is compared to another group without the disease, and then they are asked about the cause of the disease, about things in the past through either a survey, questionnaires, or this information is obtained from the patient's medical record. And here are the detailed steps for conducting this study. A group of people with the disease is brought in and compared to another group without the disease. Then they are specifically asked about various and distinct things that occurred in the past, utilizing a comprehensive survey instrument or by carefully reviewing existing detailed medical records and documentation. After that, the results are obtained and the necessary statistical analyses are performed to determine whether there is a cause in the first primary group more significantly than in the second subsequent group. Is that correct? As previously mentioned and thoroughly discussed, in this particular type of comprehensive study, the central hypothesis is rigorously tested. And when we meticulously test this specific hypothesis, we can confidently and definitively talk about the intricate concept of causation. We can precisely state with a high degree of certainty whether this particular factor is indeed a direct and significant cause of the disease or not. These are the fundamental and essential main steps that are consistently followed when conducting such important research. Conducting this type of study